thank you everyone for joining us today. My name is Maxwell Green, and I am a training manager here at NeedyMeds. So who is NeedyMeds? NeedyMeds is a national nonprofit organization. The face of our organization is our website, and it's used as an informational resource. Through our website and toll-free helpline, we connect patients to programs that provide financial assistance for healthcare expenses. We do have two special guests today who I will introduce shortly, but first I would like to go over a few housekeeping rules. If you have questions, feel free to ask them at any time by typing them into the questions bar of your control panel. At the end, I will pose the questions and either the guest or myself will answer them. This webinar will be recorded. Once it has been edited, it can be found on the webinar library page under the Getting Started tab of the NeedyMeds website. You may also find it on the NeedyMeds YouTube page. Lastly, we will provide our contact information at the end should you have any inquiries following the webinar. And with that, I'd like to begin. This webinar is co-hosted by the Patient Access Network Foundation, and today's topic is the PAN Foundation Patient and Provider Resources. The Patient Access Network Foundation is an independent national 501c3 organization dedicated to helping federally and commercially insured people living with chronic, critical, and rare diseases with the out-of-pocket costs for their prescribed medications. Partnering with generous donors, healthcare providers, and pharmacies, PAN provides the uninsured population access to healthcare treatments they need to best manage their conditions and focus on improving their quality of life. Since its founding in 2004, PAN has provided more than 500,000 underinsured patients with more than $1 billion in financial assistance through over 50 disease-specific programs. Now I'd like to give you a little background about our special guests, Amy Niles and Aisha Azam. First, I'd like to introduce Amy Niles. She's the Vice President of External Affairs at PAN. Ms. Niles oversees the development and implementation of provider and professional relations and public advocacy strategies. Before joining the PAN Foundation, Ms. Niles served for 8 years as Chair, Medical Relations and Advocacy for the Together RX Access Program. Prior to that, she was President and CEO of the National Women's Health Resource Center, now known as Healthy Women, for more than a decade. Ms. Niles has a Master of Business Administration degree from Barrack College, City University of New York, and an undergraduate degree in biology from the University of Rochester. I would also like to introduce our second guest, Aisha Azam. She's the Director of Provider Relations. Ms. Azam manages PAN's medical provider and pharmacy outreach. She ensures that PAN's providers and pharmacies receive high-quality customer service from their call center and claims administration partners. Prior to joining the PAN Foundation, Ms. Azam was a patient access specialist at the Cystic Fibrosis Foundation. She implemented a prior authorization solution to reduce administrative burdens at cystic fibrosis clinics and developed insurance content for the cystic fibrosis community. Ms. Azam has a Master of Science degree in Health Informatics and Administration from the University of Maryland University College and a Bachelor of Arts degree in Liberal Arts from the University of Missouri, Kansas City. Okay, thanks Amy and Aisha for joining us today. Amy, I'm going to switch the screen and pass the mic to you.
Thank you so much, and on behalf of the PAN Foundation, I want to thank all of you for taking time out of busy schedules to join us this afternoon. I was really pleased to see how many of you had registered for this webinar. I know some of you may be associated with local, state, and various national organizations interested in patient assistance. Some of you are affiliated with academic centers, cancer centers, and other types of organizations interested in helping patients access needed medications. Many of you are providers on the front lines who every day are looking for ways to help your patients access needed treatment. So again, on behalf of the organization, thank you for joining. Today, over the next few minutes, we're going to provide a very brief overview of the PAN Foundation and then discuss the patient journey, how patients can access and providers on behalf of patients can access needed financial assistance to ensure that patients get the treatment they need and deserve for their illness. So despite the progress that has been made with regard to the Affordable Care Act and enrollments in the exchange, many of the individuals who are enrolled in exchanges are now insured but are finding themselves to be underinsured. Today, across the United States, unfortunately, we're still finding between 25 and 30 million people being underinsured. What does underinsured mean? You see various definitions here on this slide, and for us, we think of individuals who are spending more than 10% of their annual income on out-of-pocket medical expenses as being underinsured. Or it might be the individual who has income less than 200% of federal poverty level, spending at least 5% on annual income. And just so you know, 200% of federal poverty level, for example, for a family of 4, equates to $49,000. Or it may be the senior who finds themselves falling into the donut hole who needs access to their medication. Many of you may have heard the term financial toxicity. The financial burden related to treatment can be so great that it's creating undue strain on patients and their families, it's impacting quality of life, and for many, as we have seen, resulting, unfortunately, in medical bankruptcy. We don't want patients to have to make decisions between whether they pay for their medications, accessing treatment, or being able to pay their mortgage or paying bills or putting food on the table. Unfortunately, what we do know, and many studies support this, is that patients who find themselves underinsured, unable to access medications, or unable to pay for their medications are making other decisions. They're skipping doses, they're cutting pills in half, and we know that these kinds of behaviors often place patients in emergency rooms, and they often result in increased hospitalizations. So these are the kinds of behaviors we want to avoid. We know certainly that there will be, fortunately, continued advancements in therapies. We know that costs may continue to rise. We know that there will be continued cost-sharing burden on behalf of patients. We've seen premiums continue to rise. Here at PAN, we certainly believe that there needs to be major structural changes to the healthcare system so that patients are not continuing to endure the cost-sharing burdens. But those kinds of changes, while being talked about, we think are going to take at least a few years to implement. So for the short term, we know that the assistance that foundations like ours provide will continue to be needed by millions. So what is the PAN Foundation and what kinds of services do we provide? As was stated earlier, we are a national 501c3 charitable foundation that has been in existence since 2004. And we're very proud of the fact that we have cared for and provided financial assistance to more than 500,000 patients, providing more than $1 billion in financial assistance. While we're proud of those numbers, we also know that there are millions more that really need the assistance that PAN provides, as well as the assistance from other charitable foundations like ours. We also know from our annual patient surveys that the patient assistance we provide goes a long way toward ensuring adherence to medication. So we are here to help the underinsured pay for the out-of-pocket costs associated with their medications, and we're here to advocate for improved access and affordability for patients. And we hope, as I'm sure many of you do, that one day we'll be living in a nation where everyone can get the health care they need. So the financial assistance that we provide is for the population that is insured. They may have Medicare insurance, Medicaid insurance, or may be commercially insured. Today, the PAN Foundation provides more than 50 programs, many of which are oncology programs. Others are chronic illnesses and rare diseases. We provide financial support that is for deductibles, copays, and coinsurance. Each of our funds provides financial assistance at a different level based on what we believe to be the typical out-of-pocket costs that will be experienced by patients. But the range of financial assistance that we provide on the low end may be $750, and on the upper end of the spectrum is as much as $25,000 in financial assistance over a 12-month period. This graph shows the tremendous growth that we have seen in the assistance provided to patients just in the last 5 years. And I think, very succinctly, it speaks to the tremendous need out there, and I'm sure you see this every single day. So many patients out there, Medicare patients, commercially insured, who need access to medications. And as I said, we're very proud of these numbers and hope with your support and your interest that we can even reach a greater number. So with that, I'm going to turn it over to my colleague, Aisha, who will walk you through the patient journey.
Thanks, Amy. So with that, let's go ahead and see how someone can get enrolled into the PAN Foundation and receive assistance. First, let's talk about the eligibility criteria. Within each of our disease funds, PAN has 4 different eligibility criteria. The first, the patient must have health insurance, and their insurance must cover the qualifying medication for which they seek assistance. So we need to make sure that you have insurance and that your medication is covered within our disease fund. Second, the medication must treat the disease directly. Next, the patient's income must fall at or below 400 or 500% of the federal poverty level, and it varies by fund. Some funds may be at 400%, while others may be at 500. And all of this information is available on our website, which we'll walk through in a few minutes. And last, the patient must reside and receive treatment in the United States. However, please do note that U.S. citizenship is not a requirement. Our program is administered by the Lash Group, and we have 2 call centers. One is in Charlotte, North Carolina, while the other is in Frisco, Texas. Across the board, we have nearly 200 associates dedicated to the PAN program. You can reach out to us in a few different ways. One, you can give us a call at 866-316-7263. We are available from Monday through Friday from 9 a.m. to 5 p.m. Or you can visit us online. Our website address is panfoundation.org. So when someone comes to PAN, the first question is, how do I get started and how do I get enrolled? Well, we have 4 different ways that you can enroll into PAN. The first and most popular way is to use one of our online self-service portals. We have designed 3 different portals. One is for healthcare providers, one is for pharmacies, and one is for patients. Each portal is designed with the user group in mind. For instance, the healthcare provider portal allows users to run reports and manage multiple patients. You can also enroll by phone, or if you prefer, you can request an application and send it to us by fax or mail. Regardless of which method you choose to enroll, the application process is the same. First, we collect demographic information for the patient, as well as income, insurance, and residency. Once we have all of that information, we ask the patient, or whoever is applying on behalf of the patient, to attest that all of this information is true to the best of their knowledge. PAN is proud to provide instant determination since 2013. What that means is that we can provide you with a response on whether or not you qualify for the program immediately. On the phone, you can get an answer within 30 seconds of providing all of your information, and on the website, the portal, it will show up on the screen instantaneously. When you receive that approval, we will provide you with your enrollment information on the spot. We'll give you your account ID information that you can pass along to your pharmacy so you can use your grant assistance immediately. Once you receive your approval, we'll also be sure to mail you a benefit card and let your healthcare provider know that you have received assistance. That way, if they need to apply for assistance or submit claims on your behalf, they can do so. Regardless of when you enroll or if your provider enrolls on your behalf, we do offer ongoing support, and you can access that by either giving us a call or signing on to our portal. Something we'd like to let you know about is our medical exception policy. Let's say you call us and your income is above our program requirement. We do have an exception policy that we automatically factor in. This is a deduction based on the patient's insurance type. For instance, if someone is applying for a Medicare fund and they are over income, we will look at the insurance type, identify that for Medicare we'll offer a $10,000 exception, and we categorize their income to see if they qualify. This is an automatic process that we'll do whenever someone enrolls, whether it's through the portal or online, or on the phone. So we encourage you to give us a call, and if you do have any questions about whether or not you are eligible, please do let us know. So now that someone is enrolled in the program, we encourage you to go ahead and submit claims to us so that you can use your benefit. It's important to note that we offer an automatic 90-day look-back period from when someone enrolls. Amy mentioned that everyone who enrolls receives a 12-month eligibility period, regardless of when they enroll in the calendar year. On top of that, this means that if you apply for assistance today and you are approved, you can submit for expenses that you incurred in the last 3 months. Additionally, on the other end, once your eligibility period has ended, you have a 120-day window, so 4 months, to submit any claims that you may not have submitted already. If you do have any questions about your claims, or if you're not sure on how to receive your reimbursement, please do give us a call. Our phone number is 866-316-7263. Now we'll go ahead and just walk through the two different types of claim processes. What happens if you are receiving medication from a pharmacy? Well, first, the patient will receive a copay code from PAN at the time of approval. As a patient, you should provide that copay code information to your pharmacy. And this can often be done ahead of time before receiving your medication, or you can do it at the point of sale. The pharmacy will go ahead and bill PAN, and we will adjudicate the claim in real time. The pharmacy will then receive the payment, and that will ensure that your benefit is used, and as a patient, you do not have any out-of-pocket cost. On the other end, if you are receiving your services within a healthcare provider's office or facility, your healthcare provider will need to submit the bill to PAN. In that case, the provider does receive the billing information and your enrollment information at the time you're approved. The provider will submit the bill to PAN, and PAN will process that claim. We will then issue payment to the provider. It's also important to note that if you're a patient and you pay out of pocket, you can also seek reimbursement from PAN. You can send us a copy of the payment you made, whether it's a receipt or a prescription label, and we will go ahead and issue that reimbursement directly to the patient if the patient is the one that filed the expense. Another great feature which is available online is our patient portal. So we encourage you to check it out. The website address is panapply.org. If you go online, you can easily apply for assistance, and if you enroll via the portal, you can also track your grant balance and ensure that your claims are processed in a timely way. All of that information will be available to you online. Additionally, as healthcare providers, you can visit our PAN provider portal online. This portal will allow you to register, manage multiple patients, and get all of the assistance that you need. If you do have any questions, we encourage you to note our contact information. As I mentioned, for enrollments or any claim questions, if you're calling to enroll a patient or you're just following up on a payment status, please give us a call toll-free at 866-316-7263. If you have any questions about our program strategy or any third-party foundations that we are partnering with, please do reach out to Amy. Her contact information is noted on the screen. As well as if you are a healthcare provider or pharmacy and you have any questions or patients to follow up on, please do let me know. With that, I'll turn it back to our host.
Thanks, you two. We really enjoy having professionals like Amy and Aisha to be able to provide an in-depth look into copay assistance programs provided by the PAN Foundation. And so now that you know you can go to the PAN Foundation for copay cost assistance, I would also like to inform you that there are medication cost assistance programs available as well, listed on the NeedyMeds website that may assist you if you're lacking drug coverage. I will now briefly explain prescription assistance programs, where to find them on the NeedyMeds website, and what type of information you will see for each program. So what are PAPs, or prescription assistance programs? Prescription assistance programs are sponsored by pharmaceutical companies. They provide free or discounted prescription drugs to those that qualify, and there's no law requiring pharmaceutical companies to do this, so each company does its own thing. Not every drug will have a prescription assistance program, and the eligibility requirements and applications vary from program to program. Some will help uninsured people, others will help those with insurance but without drug coverage. It varies from program to program. One common requirement is that the patient's healthcare professional usually needs to be involved. This means providing a prescription for the medications and signing the prescription assistance program application. So where can we find these programs on the NeedyMeds website? If you look at the top left of the home page, you'll see a patient savings tab, and that is where all of our patient assistance resources are listed. You can search by medications by brand name, generic name, name of the pharmaceutical company, or name of the application. So when you're looking in that database, you'll see a list of drugs. When you choose the drug that you're looking for, or when you select a drug, this is the type of information that you'll see. You'll see the contact information for the program. So if you have any questions specific to that drug or program itself, that information to contact them is available there. You'll also see program forms and application section. So that's any documents related to that specific program, including the program application itself. So you can just click on those there and print them out for your own use. You'll also see an eligibility guidelines section, and it will stipulate the income requirements for the program and the federal poverty level requirements for that program. We also have a federal poverty level calculator available on each program so you can find out what yours is. Another section you'll see is the application section for the program, and that will just show you how to apply to that program. Lastly, you'll see a medication section, and what that section will do is show you where the medication is sent to, whether it's you or your physician, and also when to reapply for that specific program. If you need assistance navigating these programs on the NeedyMeds website, I encourage you to give our helpline a call, and they can help you work through the database and disseminate the information that you have in front of you. So as you can see, whether you need assistance with copay costs or assistance with medication costs, there are organizations and programs out there geared to alleviate your medical cost burdens. So if you are insured or underinsured and your insurance covers the drug, you can use PAN for copay assistance. If your insurance doesn't cover your drug or you are uninsured, check out the prescription assistance programs on NeedyMeds. Okay, so now I'm going to open up for any questions that you may have, and I'll start by posing the questions, and then I'll either answer them myself or have Amy or Aisha answer them. So our first question is for Amy or Aisha. If a health plan must cover medication in question, why would this person need PAN's assistance?
That's a great question. So often the health insurance will cover some part of the medication, but it will still leave the patient with an out-of-pocket cost, which will be the copay that's required or the co-insurance or deductible, and that's the part that we help with. The difference is it's an insurance, if someone has insurance, but the insurance does not cover the medication at all. For instance, if you have Medicare and your drug is not covered by Medicare at all, then we would refer you to another program that would be able to help provide the drug at no charge.
Okay, great. So the next question is, will we receive or have access to the PowerPoint slides? And the answer is yes. You can contact myself, Maxwell Green, or Aisha, and either of us could provide you with the PowerPoint slides for this presentation. Another question regarding the PowerPoint slides, yes, we can get those out to you. A question, I believe this is for NeedyMeds, so for me, do you utilize any third-party companies to enroll patients in prescription assistance programs? We don't utilize them in a sense that we don't have a relationship with them, but we do have an application assistance database on the NeedyMeds website where you can actually look up your zip code and you can see which organizations in your area could assist you in applying to the prescription assistance programs that you see on our website. They'll do this either for free or for a very small fee. It differs from organization to organization, but like the prescription assistance program database, if you just visit the patient savings tab, you'll see a hyperlink for application assistance, and that will bring you to the database that will show you companies that will help enroll patients in PAPs. It does not look like there's any other questions at this time, but if you do think of something after the presentation, feel free to either contact me or contact Aisha, and we'll help you out with whatever question that you may have. If you would like a PDF copy of the PowerPoint used in the webinar, please contact Aisha or myself. A recording of the webinar will also be posted on the NeedyMeds webinar archives and on the NeedyMeds YouTube page. If you think of a question following the webinar, please feel free to contact us using the information visible on the screen. Actually, I'm seeing another question right now. Do SHIP counselors ever apply for their clients? I can't speak for every SHIP counselor, but I know there's a different SHIP group for each state. There's SHIP, there's SHINE. I know some of them will help with application assistance. Some of them won't. I recommend going into, we have a government programs database on the NeedyMeds website, and it actually lists all the SHIP sites for each state. So I recommend just checking out that database and contacting the program itself to see if they'll help their clients apply to programs. Okay, so if there's no further questions, I'd like to thank Amy and Aisha for presenting for us today, and the PAN Foundation for co-sponsoring this webinar. Thanks everyone, and have a great day.
Thank you.